Varicose veins present significant problems for millions of Americans. They are unsightly and sometimes they can even be painful. In this week's Medical Center Health Systems Taking Care of You, Dr. Hao Wu joins us with some important information about this topic. We're so thankful that you're here today. You've only been with us since March, so welcome to West Texas.
Thank you.
We're glad to have you. This affects a lot of people. Is it mostly men, mostly women, or equal?
I would say they're far more common in women.
Okay, so what causes varicose veins?
In a normal vein, there's a one-way valve built inside, and for some reason, some people, those valves don't function properly, and that leads to higher pressure in the veins, which result in varicose veins.
So I asked you if it was just unsightly, which matters. You know that we want to make sure it's okay if you don't like the way they look, and they can also. You said it's not so much pain, but a pressure that can feel that way.
Yeah, I would say pretty uncommon for people to experience sharp pain. It's more a dull achiness, heaviness, swelling towards the end of the day, usually after prolonged standing.
Yeah. So there are some treatments that have come along, and you say over the last 5 decades things have improved dramatically. It used to be a pretty difficult procedure, but now there are some treatment options.
Right. The procedures are getting less invasive over the years. In 20, 30 years ago, people had a major operation that takes an hour, 2 hours in the operating room under general anesthetic, much longer recovery time. Now we can do it in the office, takes about 30 minutes with no incision. So the recovery time is just probably less than a week, a few days, depending on what kind of work people do. So the treatment are definitely getting much better.
Wow, and the results have been very pleasing for people.
Right, I say it's much better than before.
Okay, so when I see pictures of varicose veins, I often see them on the back side of the legs, but there's probably lots of places on the body where this can happen, right?
Actually, no. Most veins are below the knee. You generally don't see varicose vein above the knee just because the veins are a little bit deeper above the knee. You don't actually get varicose veins on your arms.
Okay, so that's where you would look in the back. If you have them, you know you have them. It
right, usually below the knee and the leg, absolutely.
So what are the symptoms that people can look for that they know that this does it develop and get worse over time, or? Yes,
it's developing over time, usually very slowly, so it's over the course of months and years.
Okay, and so what do you look for? Just what it looks like?
You can see them usually.
Okay.
And also you experience some sort of heaviness, swelling very commonly.
Okay.
I would say bleeding is very rare from the veins. That's a very tiny minority of patients. And also in most extreme cases you can develop wounds or ulcers. Okay. That would say that's a very advanced stage.
And you say a lot of insurance companies will help with this, so if you have this issue, it's definitely worth the phone call.
I would think so, yes. I think there could be a dramatic improvement in their quality of life.
I love that. Dr. Wu, thank you so much. Your office is at 601 Golder Avenue. Again, if you are one of the millions of Americans who suffer with this or just don't like the way it looks, there's no reason why you can't get on top of the problem and go get something taken care of. Thank you so much for being here with us today.
You're welcome.
Appreciate you.